So this talk is delivered by Dr. Mohal banker into the Gujarat's first Interventional Radiology Conference in July 2022. Hello everyone. So first of all, I want to congratulate all the organizer team that this is my last lecture, but there are lots of audience are waiting to hear this talk, and so this congratulations is not for only inviting me as a faculty, but this is really for a huge success of this conference. So I'm a last batsman for this one-day international, and let's start with some story. So it will be a very interesting talk. So whenever I start this my pain embolization this practice, I have seen that our Indians are very જુગાડી કાઇન્ડ ઓફ માઇન્ડસેટ. એ ડૉક્ટર પાસે આવે એના પહેલાં ઘણી બધી વસ્તુઓ ટ્રાય કરે છે. મેની ટાઈમ્સ પેશન્ટ્સ કમ વિથ ડિફરન્ટ કાઇન્ડ ઓફ માલિશ. ભૂવા પાસે ડામ પણ લીધેલા હોય છે. મંદીના ઓટલે કોઈ સાધુ હોય જેને પડીક્યું આપેલી હોય દવા દુખાવો દૂર કરવા માટેની, જેનો બાયો ઇન્ગ્રેડિયન્ટ શું છે એ પણ ખબર ના હોય. મેની પેશન્ટ્સ હેવ ટ્રાઇડ ઇટ ઓલ્સો દેટ. અને ઇન ધીસ મોડર્ન એરા ઓફ Mukhyamantri Amrutam Yojana, many patients come with a very young age group knee replacement surgery કરી. 35-40 yearsના યંગસ્ટર્સ હોય એ knee pain દૂર કરવા માટે knee replacement કરીને આવતા હોય છે. So there are different kind of treatments they have taken before they come to us. So now what if all the jugaad fails? So consult to interventional radiology. So this is very important thing that if any treatment doesn't work, then whom to consult. So why interventional radiology? So let's understand why interventional radiology plays a big role into the pain management practice. So these are WHO guideline. These are pain analgesic ladder which is published by the WHO, and all the different steps of this analgesic treatment for, guided by the WHO, it is focused on the reducing the symptoms. So first, to reducing the symptoms, WHO shows the mild level of analgesic, then increase the dose, and ultimately they recommend about the nerve blocks and different kind of treatment which is effective on transmitting the pain signals through the nerve. So the WHO guidelines also basically focus on the symptoms. So it's a symptom is a pain in a joint, but why the pain occurs? Because of the chronic inflammation within the joint, but it is never focused on the root cause. So we find the root cause and we find the treatment of this joint pain, there is a chronic inflammation. And let me share you little this small story about how I found this treatment of this root cause elimination of this joint pain. So how I find this Alauddin Chirag for removing the joint pain. So people have lots of addiction of different kind of social media. People have addiction of Facebook, people have addiction of the Instagram. Even though in the modern era they have addiction of the TikTok, right? But I have addiction of Twitter. Don't only Elon Musk has addiction, but I have also addiction of the Twitter. And what happened exactly at the starting of COVID, that I was just surfing on the Twitter and I found the tweet of this Dr. Yuji Okuno. He is a young Japanese radiologist, interventional radiologist, and he has tweeted on the April 20, 2020. Lockdown began in the March end, and exactly in the initial portion of this lockdown, I found this tweet of Dr. Yuji Okuno, and what he has suggested that wherever there is a joint pain, there is abnormal blood vessels find in the area of the joint pain, and he has named the terminology called moya blood vessels. So what does it means? In Japanese language, the moya means abnormal blood vessels, which is not required into the body. And he has found it out at the site of joint pain where the chronic inflammation is going on. In this place, there's a moya blood vessels is routinely we find it out. And exactly 4 days later, he has published another tweet on the 24th April 2020, and he has published his first case about the jumper's knee, and he has shown that there is a jumper's knee, and there is a moya blood vessels over here, and after embolization the moya blood vessels disappear. Along with that, normal this infralateral genicular artery is intact. So this very important tweet of this UG Okuno, and it gave me just goosebump, and I tried to dig deeper and deeper, and I found this Alauddin Chirag, and by eliminating the moya blood vessels, he has started to remove the joint pain. So why the moya blood vessels is a culprit? So let's understand it. So first of all, number of blood vessels per square centimeter is enough for nutritional uptake. But if body wants to do some inflammatory activity, or it wants to release some cytokines for these chronic inflammation, it generates new blood vessels, and these newly generated blood vessels are in a smaller diameter as compared to the normal blood vessels, and this is called the moya blood vessels. And how it creates the pain? So these moya blood vessels create the pain by the two mechanisms. First of all, it releases the more toxic cytokines which are responsible for tissue damage, and second one, it irritates the sensory nerves along with this arterial path, and it will lead to the pain. So if you eliminate these moya blood vessels, so basically we are targeting the root cause of the joint pain. There is a chronic inflammation. So the WHO guideline right now, they are suggesting more treatment focusing on the symptoms. There is a medicine, nerve block, or some kind of surgery. But what we are targeting, there is a pain embolization technique, is targeting the chronic inflammation. So we are eliminating the root cause of the disease, and that is why the interventional radiology plays a very big role. So our journey begins, me and my partner Dr. Rozil Gandhi. We have done the first case in October 2020, and it was well reported by the different media. Our patient genuinely, she has taken एक घुटन में लगभग 9 डाब લીધેલા હતા to get rid of the knee pain. She does not want to do any kind of knee replacement surgery. She was so desperate. We have done this treatment, first case on her, and definitely આજની તારીખ પણ she is a pain free. So our journey begins in October 2020, and till date we have done more than 250 joints till in July 2022. And let me share you a few examples of these moya blood vessels, how we have treated and what are the results. So there is a knee osteoarthritis patient. The patient is 56 years old, severe knee pain, difficult to do the routine household work by her. Considered multiple orthopedic surgeon, all have advised the TKR. So this is a very common story from patients that already patient come to us. She has already consulted lots of orthopedic surgeon, and everybody has advised this knee replacement surgery. And these are classically over this area. You can see these are moya blood vessels, and post embolization, the post genicular artery embolization, the moya blood vessels disappear, and she is a pain free. So there is another case showing the moya blood vessels over here, and the post embolization picture. There is a disappearance of the moya blood vessels. So there is a 90 years old patient, not suitable for any surgery, not only because of his 90 years of age group, but patient is also suffering from atrial fibrillation, so it is contraindicated for surgery. We have done this genicular artery embolization on him. On X-ray, he has a KL grade 4 score disease. Generally, we don't do KL grade 4 disease for genicular artery embolization because patients are suffering from osteogenic pain. But as this patient is contraindicated for any kind of surgery, we have done it, and patient mobility is so much restricted to confined to his home only. So we have done it, and ultimately his VAS score reduced from 10 to 4 and started his routine work into the home. So genicular artery embolization works very well in this patient also. So this is a case of rheumatic arthritis of knee joint. These are moya blood vessels over here, and the supralateral genicular artery is intact over here, and still patient becomes pain free. So this patient has taken already lots of rheumatic arthritis medicine, but it is not responding. Severe pain in knee joint, even at night, unable to sleep, even though patient is not very comfortable or confident to walk also. So much inflammatory activity in the knee, within her knee joint, and after genicular artery embolization, she is absolutely pain free. So another example of the jumper's knee, and athletic person suffering from jumper's knee, pain around the kneecap. Since last 4 years, he has shown to more than 30 orthopedic from Gujarat, Mumbai. He's a big shot and he's shown to lots of consultants, but there's no result. We have done this genicular artery embolization, this eliminating these moya blood vessels. His pain is disappeared. So these are IT band syndrome, suffering from 1 year, and severe pain in outer side of the knee joint, increases with the activity after genicular artery embolization. With elimination of these moya blood vessels, he becomes the pain free. So this is another case of patient suffering from pes anserine bursitis. Patient has a pain in inner side of the knee, suffering since last 2 years, and this inframiddle genicular artery shows the moya blood vessels, and after embolization the moya blood vessels is disappear, and by doing this patient becomes the pain free. So not only knee joint, this treatment is effective in all the other joint also. Let me give you example of this frozen shoulder. These are diabetic patients, severe night pain since last 3 years, basketball player, but because of this shoulder pain, he is not able to play his routine game. We have done the embolization, and after 3 years he is able to sleep without the pain and started the basketball. So these are moya blood vessels over here, over this area, and post embolization the main arteries are intact, but the moya blood vessels are disappeared. So this is a case of tennis elbow. Patient developed tennis elbow, is a professional writer, already taken the PRP injection, but it didn't work, and pain embolization treatment has relieved his 80% of pain. And this ankle pain patient developed ankle pain after chikungunya infection, which is common in our area, and suffering since last 9 months, and we have done the pain embolization and it relieved her pain. So these are moya blood vessels, and after the embolization the main arteries intact, the moya blood vessels disappear. So this is a classical case of Achilles tendinopathy. Since last 2 years, not responding to physiotherapy, has taken so many Ayurvedic medicine, Agnikand and lots of things, but not responding to it. And we have done this pain embolization treatment. Here is a classical, these are moya blood vessels at the insertional site of Achilles tendon, and post embolization, these are moya blood vessels disappear, and along with the moya blood vessels, patient pain also disappear. So this is a classical case of plantar fasciitis, which is very common in Indian females. This patient is suffering from since the 2 years, not responding to physiotherapy, even though she has taken the steroid shot, but it is not effective in her case. And after pain embolization treatment, the pain is removed within 30 minutes. So these are sacroiliitis case, and you can see over these are moya blood vessels along near the SI joint, and post embolization the main artery is intact and the moya blood vessels disappear. The patients have relieved into the lower back pain. So what we can treat and what we cannot treat, this is very important to understand. We learn after lots of cases when we are done, and after initial failure or in many cases we learn this, and I want to share this our experience with you, that basically with the pain embolization we are removing the root cause of chronic inflammation. So we can treat any knee pain, any joint pain due to the chronic inflammation, whether it's the interphalangeal joint, knee joint or shoulder joint, or any fingers or any other joint which is affected by inflammation. But this treatment is not effective for neuralgic pain. So any pain occurring due to the disc prolapse or due to the nerve compression, that we cannot eliminate it with this technique, because this is not due to the chronic inflammation, it is due to the some nerve compression. So recently we have done this, we got this message from one of our leading North Gujarat physicians. We have done the genicular artery embolization into her wife case, and she has gone for knee replacement surgery, but it was not very successful. She was still suffering since for a knee pain, and initially we were very reluctant. We don't know that post TKR knee pain will be eliminated with this technique or not, but we have done this genicular artery embolization in her case, and we got this message, and he recommended that genicular artery embolization is very effective for post TKR knee pain also, because his wife is relieved by this knee pain with this technique. So when the orthopedic also failed to relieve the knee pain with knee replacement surgery, interventional radiology plays very important role to relieve this knee pain. So thank you so much, and as this is an interventional radiology conference, don't underestimate the power of interventional radiologists, because it plays very important role for relieving any joint pain which surgeon cannot remove. Thank you so much.